Welcome to this course, Farm Biosecurity and One Health Fundamentals. The coordinator of the course, Jessica Nahavuma, and those are my contact details. There are other members of staff who are involved in delivery of this course. So delivery will require your input. You have to read the materials that are provided in order for you to understand and appreciate this particular course. This course focuses on equipping students with knowledge and skills for production of safe animal source foods for human consumption through implementation of farm biosecurity measures and other approaches. So as you appreciate what safety of the animal or foods are, although our interest is mainly on the animal source or foods, you also appreciate the management practices that are important in ensuring safety of the foods and all the products from the animals, and the upcoming or the emerging approaches were like the One Health approach for management of the diseases. So we shall also look into the policies. What is expected of the foods that are produced from a particular farm or from the different farms. We may not have clearer policies, but there are fragmented regulations that one can follow. The objective is to impart knowledge and skills in relation to farm. This is in the case of processing or farm at the production level. So the knowledge and skills in relation to farm or farm biosecurity, the food hazards, the good management practices and policies appropriate for production of safe animal source foods. So the learning objectives are what we expect from you. I would expect you to know the simple on-farm or farm biosecurity plan. And how do I know that? It's by you to be able to develop that biosecurity plan. You either apply it on your own farm, or you advise fellow farmers, or you advise farmers. You may not be a farmer yourself. You should be able to describe the different types of food hazards. As you will see later, there are very many undesirable contaminants in foods that may cause illnesses to the consumers. So we have to know what those hazards are, what are their sources, and probably how we should avoid them. That's where biosecurity comes in. We should describe and implement good management practices for production and processing of safe animal foods. So you know that for value addition, you must process. It gives a longer shelf life to the food. However, if it's not done properly, you may introduce those undesirable substances that will contaminate the food, make it unwholesome or unsafe for the consumer. You should be able to ensure quality and safe animal resource foods, and this can be achieved by you implementing or observing the good practices, the One Health approach, and so on. And also to fit within the regulations, whether national or international, because we know, like, we have National Bureau of Standards. It sets a particular food should have so much bacterial load in order, not more than so much bacterial load in order for it to be safe. So there are some terms that we shall encounter during this course, and I'm giving some definitions of this. Biosecurity are the measures that are taken to stop the spread or introduction of harmful organisms to human, animal, and plant life. Biological, that's why we are focusing on organisms. And the main objective is to protect against harmful organisms to these lives, the human, animal, and plants. Biosafety addresses the safe handling and containment of infectious microorganisms and hazardous biological materials. With the biosafety, they are already there. They have gained access to your farm, but you want to get a way of removing them or preventing them from spreading further. Whereas biosecurity is to prevent their entry, and if they've entered, then also to stop spread. So that means with the biosecurity, biosafety may be a subset of biosecurity, but with the biosecurity, one has to be very, very careful to detect the entry or appearance of a new disease as soon as possible. Food safety describes the handling, preparation, and storage of food in ways that prevent foodborne illnesses. So all of them will have safety issues, but depending on what we focus on, we have different terms used as before the term safety. Hazards, these are agents which have the potential to cause harm to a living target. So the food may be contaminated maybe with a metallic metal, like in cows when you feed them, or in cattle when they are fed with foods that are contaminated with some of these metals. We know that they can pierce the rumen or the reticulum, which will affect. But we have those organisms that can also be introduced via food, and they cause disease to the animals. So those are different types of hazards. The person who will handle this topic will be able to bring you on board on the categories and the sources and probably how we can avoid them. Then more definitions. We have food hazards. Any agent with the potential to cause adverse health consequences for consumers. So this is also a hazard, like for the previous bullet, but this is in relation to a food. If someone consumes food containing a particular hazard or associated with a particular hazard, then it may affect the health of the consumers. The other term is legislation. This is a law or laws passed by a government. I'm not very conversant with this. I think the person who delivers the topic, the related topic, will be able to bring you on board. However, I'm aware we have the department, a newly formed Department of Biosafety and Biosecurity under the Ministry of Science, Technology, and Innovation. So I heard some time back there were bills in the Parliament trying to discuss the biosecurity issues, biosafety and biosecurity issues. But I think what drove this process is mainly the genetically modified foods is the one that drove this process. But I'm sure other sectors will also be able to benefit from this because it should be all-encompassing. And I pray that various bodies are involved. The Ministry of Agriculture, Animal Resources and Industry are involved, as well as others, the Ministry of Health and so on. Then regulation is a rule or directive made and maintained by an authority. So an authority is a level below the government. So we may have regulations or rules set up by, like, for example, the Kampala City Council Authority. These may be they may be reinforced within the designation of Kampala City Authority, but not in other areas. In Wakiso, they will not be recognized. So these but they should be feeding into a legislation, or the government may also draw from these regulations to develop laws that can be followed nationally. Then we have policy. Policy is a course or principle of action adopted or proposed by an organization or individual. So we can see that we have an authority, probably in KCCA we have different departments. So those departments can also have their own policies. Like the university has policies. We have the human resource policies. So they are different. So, and all these, if they relate to biosecurity or the food safety, they should be followed to guide in the implementation of the relevant practices required to ensure food safety and farm biosecurity. Then we have the One Health concept. This is an integrative effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and the environment. So all this is all about life. In the olden days, each discipline was working by itself, probably without considering what the others are doing. There could be repetition, there could be need for synergy, which would not be obtained. So, and the best example here are those zoonotic diseases that are transmitted from animals to humans, or from humans to animals. So if we have an animal as a reservoir of infection to the human, however much the human doctor will treat that patient, chances are high there will be re-exposure from the animals. So the best option would be to control the disease at the animal level, and that way will not have a source of infection to the humans. Or if it's in the environment, to look into what are those factors that are influencing spread from the environment, maybe to the humans or to the animals. And those will help in knowing those factors will help in devising means of controlling the disease. So we have a number of references. It is not limited to this. You can just go to the internet and also get more information on any of the topic to be well acquainted. So there is preventing and mitigation contamination during food processing. There is foundations for food protection professionals, current concepts in food protection. All these are more on food safety. Then there is biosecurity in animal production and veterinary medicine. So probably the person who handles, for each one who is handling a topic, will be able to give more references for you to consider. I thank you very much for your attention. Okay.